Hello everyone, you're watching Sightline. Our guest today is Mr. Alex Heikens, representative of the United Nations Children's Fund in Mongolia. Mr. Alex Heikens, it's good to see you.
Hi, good evening.
So, you worked as the country representative here in Mongolia for the UNICEF for 4 years. So, could you tell us what it was like to work in Mongolia and also what kind of big projects and initiatives that your team has made during your tenure?
Well, first of all, it's been a real blessing to work and to live in Mongolia. It's such a rich experience, and in terms of work, it has been a roller coaster. You have kind of before pandemic and during pandemic. So before pandemic, some of the things that we were working on was air pollution. Very big issue. One of the things that we achieved was to make it clear that this is not just an environmental issue. It's first of all a maternal and child health issue. Damaging lungs, damaging brains, damaging DNA, and then moving into action in terms of educating the health sector about it, working on improving indoor air quality in kindergartens and hospitals. A new policy is now in place, making good indoor air quality mandatory in hospitals. We've also been looking at better air quality monitoring, and not only in Ulaanbaatar, but also in many of the provincial centers. So for example, in Bayangkongwar, we developed a low-cost air quality monitoring network, and we hope that that will be replicated across the country in the coming years. We also helped households who live in the Gur in the cities to switch from coal to electric heating, combined with very good insulation. This is our so-called CHIP initiative. And I'm very glad that the Ministry of Environment recently approved our package for the green loan program that they have to make it financially more affordable. Another important initiative that we worked on is shock responsive social protection. Now, what does that mean? Shock responsive social protection. Social protection is common, but one of the things we realized that if there is an extreme event, for example a dzud, is it possible to provide quick and fast financial assistance to families in need and use an existing system for that instead of creating something new for that specific emergency? So in the winter of 2019, we piloted that for the first time in Zafgan, where Zafgan being very prone to dzud, we indeed provided additional cash assistance to children in Zafgan before, during and after the dzud. And that really helped them to get through the difficult situation. And then another example of something we did, small but still very impactful, and it's very recent, a self-defense program for children. So we've been working with the Mongolian University of Education and the Mongolian Jiu-Jitsu Federation, developing the self-defense program. And now 2 clubs recently opened.
One is in the Lanton.
Yes, one over there, and the other one at Metro Mall, Black Belt Jiu-Jitsu Academy. So it's a really good opportunity for children who normally would not have access to such programs, such activities. First of all, to be active, to learn a new skill, to build self-confidence, and of course also learn how to defend yourself, because we all know there is unfortunately a lot of violence against children and also among children. So having those practical skills and building respect among each other, this is really good, and I'm very glad to see both boys and girls enrolling in these programs and being very enthusiastic about it.
Thank you very much. So you've been very busy during the 4 years working on the air pollution project and also the shock response social protection, which is something actually new.
Yes, that is brand new. It was kind of funny that we were developing it, we started the pilot, and then our headquarters started to doing the same thing. So we were really ahead of the curve here in Mongolia in terms of figuring out, in a world where we see more and more extreme events, whether it is weather-related or pandemic-related, how do you provide support to vulnerable people quick and fast and efficient? So that's really what we wanted to do. And then, of course, the second half of my tenure here, it all became about the pandemic. And one of the first things that we did, it was in March 2020, I wrote a letter together with the UN Resident Coordinator to the Deputy Prime Minister, advising them to use this shock-responsive social protection mechanism that we just tested for Zoet, to apply it
COVID-19 impact.
for COVID-19. So of course you can imagine that we were very happy that indeed the government moved forward with it, that they did indeed apply it, and that they were very generous, and that they still up to today they are providing this additional cash assistance to children. And importantly, the analysis done by, for example, ADB showed that this was the most effective measure the government took to prevent an increase in poverty in Mongolia because of the pandemic.
So we have all been facing the challenges because of, due to the global pandemic, COVID-19. So like what kind of challenges would you say the families and also their children face, particularly because of COVID-19?
Yeah. We quickly realized that when in January, February this all started last year, and the decision was made to close all the schools and kindergartens, that we would first of all have a child protection issue, and secondly that we also would have an education issue, and thirdly, obviously, that the families would get into big financial problems as well. So the financial problems, those were to a significant extent addressed by advising the government to top up the child money program, to provide more cash.
From 20,000 to 100,000 for each child.
Yes, it allowed the families to continue to provide for their children. When you look at what the families used the money for, most of it was for the very basic needs. Buy food, buy clothes, exactly, to stay warm, and other really essential kind of support for the children. So that was part of the problem that was kind of addressed through topping up the child money program. But then we still had the other issues around violence against children and the education problems. Because suddenly you had all these children stuck at home, and if there is already tension in the family, of course the tension will increase. People were losing their jobs, creating even more tension in the families. So we saw a sharp increase in violence against women, children, and also violence against women, by the way. So one of the things that we've done was upgrading the child helpline, so that you no longer can reach it only by telephone, but also by SMS and through social media. Kids are on their phones these days. Yeah. But when you are in an abusive situation, it's not always easy to make a call. It's much easier to send a text message. So that was a small but very important thing that has happened. And we also worked on making sure to keep the shelters open, because of course with the pandemic everything at some point became more closed and locked. So working with the Ministry of Labour and Social Welfare to keep the shelters open, to make sure the social workers could continue to go there. And then we also promoted, for example, flexible work arrangements in the private sector. Flexibility allows parents to better look after their children. We also supported similar work in the context of the health sector itself. Many doctors and nurses, and by far the majority female, were working kind of non-stop 24 hours, 2 weeks, 3 weeks at the same time, and could not go home. So who was looking after their children? So all these things had to be addressed and worked on. So that was another part in terms of child protection. And then finally on education, the TV lessons that were introduced, it was a good start, but we also realized that a lot of extra work had to be done to improve the quality, to improve the outreach, to make sure that also ethnic minorities and children with disabilities would have some access to education. So yeah, it's been extremely busy for my team, and I'm very proud of what we achieved.
Okay, thank you very much, and it's very great to hear lots of this actually real works done in order to mitigate the impact of COVID-19 on children. So in general, could you tell us how you define the Mongolian children's well-being and the protection of their rights?
I think if you look over the last 10, 20 years, we see a steady improvement of children's well-being and fulfillment of their rights. So it was all going nicely in the right direction. Of course, there are weaknesses, there are issues. Generally speaking, violence against children is a major issue. Quality of education was already a significant problem. Nutrition is a problem. We see more and more obesity, for example. I think about especially in the urban setting, and at the same time many children still suffering from micronutrient deficiencies at the same time.
Like malnutrition?
Malnutrition, no. Malnutrition is basically not getting enough food. Micronutrient deficient is more about not getting enough iron, not getting enough zinc, not getting enough vitamin D or vitamin A. So it's not about the calories anymore, but it's about the vitamins and the minerals.
The quality of the
quality,
diet.
absolutely, yes. The quality of the food is a real issue, with many children in the city getting too many calories, but not enough vitamins and minerals. So many different issues, but overall a steady improvement. Now, and then the pandemic hit. And then, of course, the world was turned upside down. And I think the education is the biggest issue now. Because, as I said earlier, although improvements were made with regard to TV lessons and online learning, overall, the picture was that about 30-40% of the children did not follow any of that.
Yeah.
That is a very big number. I mean, we have about 800,000 children going to school. So we now have a serious gap. And even those who did follow the TV lessons, of course, they did not get the full learning experience as they normally have. And then on top of that, it was not only about learning, it was also about social skills. I mean, if you don't see any other child for 1.5 years, if you don't interact, if you don't play, your social skills are also becoming less. And then when we look at the poorer children in the community, many of them are heavily relying on the lunch provided at the kindergarten. That did not happen anymore. So where did they get their lunch? And what quality was that lunch? So it was affecting many different elements. So I think from a child rights perspective, the right to go to school has been very, very problematic. And that will require a lot of action over the next years. Because recovering from 1.5 years for limited education will take more than 1.5 years. That will take at least 3 years and probably even more than that. And that, of course, then will affect their future kind of opportunities in jobs and income. So you will indeed, unless we take very firm action, you can expect, really difficult times for these children that went to school during this pandemic, or were supposed to go to school during this pandemic.
Yeah. Okay. So also, one of the biggest issues impacting children and their well-being is inequality, disparities between the rich and poor. So what should be done to address this issue? What would you say?
You're absolutely right. There is a big gap between the poor and the rich. And that the problem with that is it goes from generation to generation. If you are born in a poor family, it is hard to get out of poverty as an adult. So then it continues and continues. So breaking through that is what needs to be done. And of course there are some key ingredients to that. Good education, good health, good nutrition, a safe and supportive environment. Now, what can the government do in that context to support that in a poor community is indeed a very solid social protection mechanism to have that in place. That is not only looking at financial support, but also the services towards that community. So that, for example, a school in the Gur district provides equally good education as a public school, for example, in Zaysan, where I live. So it's about providing good quality services also to those who really need it the most and who don't have enough money to send their children to a private school. So what do we do indeed more for the poor in the community? And I think it's really investing in their education, in their health, and make sure that they feel safe and supportive. Because only with that, I think it's possible for them to break out that cycle of poverty under one condition. And that is, of course, that government and private sector also need to work together to provide more good quality, decent jobs. Because it's great when you have an education, but if there's no job for you waiting, that also doesn't help. And one important thing that needs to be done moving forward is to make sure that the jobs of the future are connected to the education of today.
That they're receiving.
Exactly.
There are actually like children who are living in the like distant areas of the city or in the rural provinces. So there are like some places there are lots of children in like only one classroom. So maybe like over 40 or almost 50. So it's actually like a very big problem. So I saw your tweet about the Mongolian like child protection, the child money program, and you said that it's not just a child care grant, it's an investment for the children. It is granted for every child. So do you think that the government should continue granting the money for every child, or should there be like differences between the child who are living in a poorer situation?
Yeah. So the 20,000 Tukrik child money program started back in 2012. If you do the math and you correct for inflation, 40,000 Tukrik today is the same as 20,000 Tukrik about 10 years ago. That's something that we need to keep in mind. Now, we really appreciate that the government is taking that universal approach and says, let's keep it very simple. Let's provide it to every child. Now, there's always that discussion, should we not really target it to the poor, those who need it most? On one hand, it is very easy to say, yes, of course, that should be the case, because you want to invest the money where it is needed the most. On the other hand, targeting and identifying poor children is quite difficult, actually. And to distinguish who and who should not receive the funds, it's a lot of work. And that means it takes a lot of money to target. So for the sake of simplicity, and if you really want to make sure that you reach the poorest children as well,
just universal.
Start with giving it to all the children. That is a very good, straightforward starting point. Because the problem with the targeting is your data from 2 years ago are no longer accurate for today. So you need to continuously update those data in order to give a fair assessment. And to avoid that, if you're not ready for doing that, do it universal.
So if you're updating the data, then it will also takes lots of budget to do that.
Yes.
So about COVID-19 vaccines, I've seen lots of messages on social media in relations to the COVAX facility, how they're delivering vaccines to the developing countries. So can you tell us about what UNICEF is doing to support Mongolia with its national COVID-19 vaccination program?
We are very, very active on that, especially together with the World Health Organization. So it's very good teamwork. And indeed, it started with, help the government to design the program as a whole, the vaccination program. Look at what are the needs, what is the situation with all the cold chain equipment, how many vaccines are necessary, where can we get them, and then how do you deploy them, and make sure that people get access to reliable and understandable information. So we've been working on all of these different aspects. We have now coming in more than 800 new freezers and fridges. We are finalizing the construction of the new central vaccine store
at the NCCD.
At NCCD, good progress over there. We have also indeed supported the government with accessing the global COVAX facility for vaccines, and a few 100,000 have arrived through COVAX. But we also supported the Mongolian government in their contracts with Pfizer for 2.5 million doses, of which 2.3 million doses are funded by Japan through UNICEF. And then indeed, the whole communication campaign is really important, that people understand the importance of vaccinations. When they have questions, they know where to go, they get a reliable answer. I see, of course, a lot of good progress in Mongolia with regard to vaccination. we still have significant concerns about the very high numbers of community transmissions. So we need to push both for more vaccination and continue good practices in terms of social distancing, and whenever you can, wash your hands and wear a mask, so that together we can get and keep each other safe.
So our time is unfortunately coming to an end. So what final message would you like to give to our audience?
I think that the most important thing to do right now for the children, as we are slowly getting towards the end of the COVID pandemic, fingers crossed, we need to reopen the schools. The kids cannot afford any more staying home. So we need to do that, in a safe way, of course, and make sure that all the kids get back to school. And then secondly, we also, the coming years, need to make significant investments to help children to make up for all the lost time over the last 1.5 years in terms of their education. And that means more budget needs to be invested. And also, I'm asking parents, invest more time in your children's education and support them, because they have to get back on their feet in terms of their education, because it really has a major impact on their future.
You've watched Sightline. Our today's guest was Mr. Alex Heikens, representative of United Nations Children's Fund in Mongolia. Thank you for watching. Goodbye.